Hi, my name is Bianca Liu, and I will be discussing the demographics and health statistics of my New York City community, which is the Flatlands and Canarsie neighborhoods of Brooklyn, New York. Using the selected New York City community Flatlands and Canarsie, which is District 18 in Brooklyn, the demographic and health statistics provide a snapshot of the population's composition and major health concerns. This community has 190,798 residents with an average life expectancy of 82.1 years. Additionally, 79% of residents rate their health as good, very good, or excellent. The neighborhood is highly diverse, with 40% of residents born outside the US and 11% having limited English proficiency. In terms of race or ethnicity, the largest group is Black residents, 57%, followed by white, 28%, Latino, 9%, Asian, 5%, and other, 2%. Health outcome data shows, I will go to the next bar graph to depict this. Health outcome data shows chronic disease burdens that exceed New York City averages. In Flatlands and Canarsie, 41% of adults are obese, 17% have diabetes, and 36% have hypertension. These rates are notably higher than the New York City averages of obesity, which is 25%, diabetes 12%, and hypertension 27%. This suggests that the community may face disparities related to nutrition, access to preventative care, physical activity, and chronic disease management. Now, to classify this data into statistical analysis, we'll start with nominal data. Nominal data are categories with no inherent ranking or numerical meaning. Some examples include race and ethnicity, as shown here, which would be Black, white, Latino, Asian, or other. Whether someone is born outside the US, whether they have limited English proficiency, or simply the name of the community, which is Flatlands and Canarsie. These variables simply classify residents into groups and give them a name. Moving on to ordinal data. Ordinal data are categories that have a meaningful order or ranking, but differences between categories are not equal. For example, self-rated health status, poor, fair, good, very good, for example, or the ranges of age groups on the x-axis of the bar graph, 0 to 17, 18 to 24, 25 to 44, and so on. These categories can be ranked from lowest to highest, but are grouped ranges rather than exact values. Interval data are numerical values where differences are meaningful, but there is no true zero. For example, the number of years that were used to collect all this data on average, the surveys were collected from the years 2010 to 2019, and the other one, 2019 to 2020. These numbers measure intervals in time, but year zero does not mean absence of time, which refers back to interval data not having a true zero. Ratio data are numerical values with equal intervals and a true zero, which allows for significant comparisons. For example, the population size, the average life expectancy, and on the other graph, the percent of the population that is obese, diabetic, or hypertensive. These values have measurable magnitudes, and zero would represent none of the quantity. In conclusion, Flatlands and Canarsie is a culturally diverse Brooklyn community with a strong life expectancy, but significant chronic disease burdens, especially obesity and hypertension. Understanding these statistics by measurement type, nominal, ordinal, interval, and ratio, helps nurses and public health professionals analyze community needs, identify disparities, and plan targeted interventions. In presenting this data with the meta paradigm concepts of nursing, we will address this under four categories: person, health, environment, and nursing. Public health advocacy in Flatlands and Canarsie must be guided by the four nursing meta paradigm concepts. These concepts help explain how nurses can address the community's needs while promoting health equity and disease prevention. Person. The person represents the individuals, families, and populations living in Flatlands and Canarsie. This community is culturally diverse, with many residents born outside the United States and some experiencing limited English proficiency. Each person should be viewed holistically, with physical, emotional, social, cultural, and spiritual needs. Advocacy means recognizing that residents are not statistics. They are people with unique lived experiences, barriers to care, and strengths. Public health efforts must respect cultural beliefs, language preferences, and family structures when delivering services. Health. Health is more than the absence of disease. It is the ability to achieve wellness and function fully in daily life. Although many residents report good overall health, the high rates of obesity, diabetes, and hypertension show that preventable chronic diseases remain serious concerns. Advocacy should focus on increasing access to screenings, preventative care, nutrition counseling, mental health support, and chronic disease education. Health promotion programs must empower residents to manage their own health and prevent complications. Environment. The environment includes all external factors that influence health, such as housing, neighborhood safety, food access, transportation, education, employment, and healthcare availability. In Flatlands and Canarsie, environmental factors may contribute to chronic disease disparities, including limited access to healthy foods, safe recreational spaces, or affordable healthcare. Public health advocacy requires addressing these social determinants of health by supporting cleaner neighborhoods, safer parks, community gardens, reliable transportation, and accessible healthcare services. Nursing. Nursing is the profession that bridges people, health, and environment through compassionate, evidence-based care. Nurses are trusted advocates who educate, prevent illness, coordinate care, and speak up for underserved populations. In the community, nurses can lead blood pressure screenings, diabetes prevention workshops, school wellness programs, vaccination drives, and culturally competent outreach. Nurses also advocate for policy changes that expand healthcare access and reduce disparities. I'll stop sharing my screen as I conclude my advocacy statement. As nurses, we must advocate for the people of Flatlands and Canarsie by promoting health, improving environmental conditions, and delivering equitable, culturally responsive care. By addressing the whole person within their environment, nursing can reduce chronic disease burdens and strengthen the health of the entire community. Thank you.